Good.
Hi,
Hi,
introduce yourself.
my name is Robbie Hanna.
What do you do?
I'm a gynecologic oncologist. Basically, in lay terms, I'm a women's cancer doctor. I do all the women's cancers except breast cancer. I do surgeries and I also do chemotherapy. And I'm also an expert in robotic surgery.
So, what do you think about medical miracles?
Medical miracles are possible, all right? But just like any miracle, with any act that you would want to happen, which is in the path of goodness, it's the power of prayer and the power of working towards that act.
So, in other words, do you or do you not believe that medical miracles really do exist, or do you just think that it's mainly science that goes behind everything?
Science and miracles are attached together. Before, what would one think that going to the moon is a miracle? It was actually something that happened because we worked towards it. We didn't just pray towards it.
Have you ever witnessed a medical miracle?
So this is where we have to define what a medical miracle is. A medical miracle could be cure. At the same time, and because of I deal with very sick patients, a medical miracle could be that someone does not suffer from their illness, or even someone and their family do not suffer during their death. So, in my mind, that is a miracle by itself because suffering, if it's eliminated, it is a very, very good thing.
So, out of all the ones that you mentioned, the subcategories of medical miracles, have you witnessed any of them more than others, or any at all?
Because of the nature of the diseases that I take care of, a lot of my patients eventually succumb to their disease. So, witnessing the latter categories are more than the first. With that being said, some of my cancers are patients who uh, have an early cancer and they are cured from their cancers.
Have you ever talked to other doctors about medical miracles?
Yes, and you have to respect different opinions, and it's also how you present it to people about medical miracles. And again, just praying for a miracle without action is not going to work. So you have to act towards it and within reason.
So, within your years of education in the medical field, did your professors ever bring up a such thing as medical miracles?
Well, mind you that my medical education was a while ago, so there was no discussion about religion or belief systems in patients. It was more or less training you towards learning how to use the science that you learn towards diseases. So, short answer is no. Nowadays, we are looking at things and discussing the spiritual issues of patients to our residents, to our medical students, to teach them how to deal with such. And should they believe in them, that's a good thing. And if a person has any opposite thoughts and ideas, then we ask them that they should be respected and not opposed to a belief system that believes in miracles.
So, thank you for joining me today in this interview. Say goodbye to the people.
Goodbye. Good luck.